Wellness Health Services Health Talks. I'm Dr. Joshua Delito, a family physician. Our talk today is on dementia. Dementia is a condition where there is loss of the cognitive functioning, resulting in impaired thinking, reasoning, and the loss of the capacity for the performance of the daily activities of living. It ranges to mild to severe, and affects mostly the elderly people from the age of 65 going onwards, but it can have earlier onset in some situation in people below 63 years. It's not a common part of aging, so it is an illness. You cannot say that dementia or loss of the cognitive function is a common part of aging. The symptoms are caused due to the loss of the brain cell functioning, which sometimes there could be deposition of plaques in the neurons, leading to loss of the brain cells. The presentations include memory loss, where there is poor judgment and sometimes there is confusion. You can have difficult speaking and the understanding or expression of thoughts. You can have worsening and the loss of familiar neighborhoods or even familiar people. There's trouble handling money, repetition of questions. You can have use of unusual words which do not have any meaning, taking longer to complete normal activities of living, and loss of interest in the daily activities of living. Some individuals with hallucinations, they can have, with dementia, can have hallucinations, and they can also have poor coordination of activities. Usually there are four main types of dementia. There's the Alzheimer's dementia, which affects 70% of the people with the dementia, and there's a build-up of abnormal plaques in the neurons in the brain. Then there's the frontotemporal dementia, and then there's the Lewy body dementia, where we have abnormal plaques in the brain, affects about 10% of the individuals, and there's vascular dementia. Vascular dementia is one of the possible preventable causes of dementia, because this is caused by abnormal plaques in the blood vessels, so that you have small blood vessels closing up and some part of the brain are denied the blood supply. And this can be caused by conditions like hypertension, abnormal lipids, smoking, diabetes, condition we call atrial fibrillation or abnormal beating of the heart, conditions like HIV, neurosyphilis, or deficiency of vitamins like B12 and folate, sometimes dietary deficiencies, and also age. So the risk factors for dementia include age, increasing age, family history of dementia, which is commonly affects individuals who have first degree relative dementia. Then it is more common in females than in men, and also the presence of these lifestyle diseases like diabetes, hypertension. The diagnosis is usually from the history of the presenting symptoms. Of course, sometimes doing a brain CT scan to help rule out other conditions that can bring abnormal mentation, and then blood works. The blood works in dementia help to rule out presence of vitamin deficiencies, conditions like low thyroid functions, electrolyte imbalances, and also the presence of neurosyphilis. Treatment: there is no complete cure of dementia. The drugs that are used currently help to slow down the loss of the neural functions and the loss of nerves. Of course, keeping these individuals engaged helps to slow down the loss of brain cells, and also engagement in aerobic exercises. So dementia is a progressive condition that affects the brain, which is characterized by loss of brain cells. There are commonly four types of dementia, and usually the investigations include ruling out the possibility of vascular causes of dementia, which can be reversed, but the treatment for dementia is there's no cure at the moment, but the drugs used to treat the disease usually are used to slow the process of loss of neural functions, so that the individuals can be able to live a comfortable life. The cause of death in dementia is usually due to infections or complications. As the disease progresses, individuals lose most of their motor functions, including swallowing, and you can have aspiration leading to pneumonia, and is a common cause of death in dementia. Thank you for watching.